Did you ever dive underwater and begin to feel pain in your ears and you weren't sure what it was and how to fix it? Hi, I'm Marissa and I'm a PADI Master Scuba Diver. Today, we're going to be talking about equalizing. What it is, why divers have to do it, what areas of the body are affected by pressure, how to equalize, and what are the consequences if you don't equalize. There's a lot of information here, so let's dive in. What is equalizing? It's the process of balancing the pressure in your body's air spaces with the surrounding water pressure as you descend. Why do divers have to equalize? The human body is made up of roughly 60 to 70% of water, and the water in your body doesn't compress under pressure when you descend. However, the air spaces within the body, and those in contact with it, like a dry suit for example, are affected by the increasing pressure, and these air spaces will compress. As the air volume decreases, the surrounding water pressure pushes in on the body tissues around those spaces, and if you don't equalize, you're going to feel pain, discomfort, and possible injuries. These are the air spaces that are affected by pressure: ears and sinuses, mask, lungs, dry suit, and the air in your tank. But the air in your tank you cannot equalize. All you have to do is really monitor your NDL and your SPG. If you don't equalize for pressure when you're descending, you can experience something called a squeeze. And this is caused when outside pressure is greater than the pressure on the inside of your body's air spaces. So with an ear squeeze, you have the water pressure pressing in on your eardrum and your middle ear, and if you don't equalize, this is going to cause discomfort. Discomfort in your cheeks, your nose, and your middle forehead is from a sinus squeeze. A pulling or a sucking sensation on your face is from a mask squeeze. You can easily prevent squeezes. All you have to do is add air to those air spaces as you descend. Next question is, how do we equalize these air spaces? For your ears and sinuses, there are a few different ways to do it. I'm going to briefly go over 4 methods. The first one being the Valsalva maneuver. This is the one that I use and the one that I find most effective for me. But of course, you can use whichever one works best for you. For the Valsalva maneuver, all you have to do is pinch your nose and gently blow against it to force air into your eustachian tubes. Here's a video of me in Tobermory using the Valsalva method to equalize as I descend. The second method I'm going to talk about today is the Tonybee maneuver. For this, all you have to do is pinch your nose and swallow at the same time. And this is naturally going to open your eustachian tubes. The third method is called the Frenzel maneuver. And this is done by pinching your nose and you use your tongue and throat muscles to make a K sound. I personally, this one just doesn't work for me, but I'm probably doing it wrong, so I don't even attempt this one underwater. And the fourth method is the voluntary tube opening. And this is where you tense your soft palate and your throat muscles as if you were starting a yawn to actively open your eustachian tubes. And personally, I would never even try this one underwater because I know myself, and if I start a yawn, I'm going to finish a yawn and it's going to happen underwater and I really don't want it to. So I don't even use this one at all. The Valsalva maneuver for me works perfectly fine each and every time. So you can use whichever method is best for you. There are a couple more methods, but these are the ones that are most common. To equalize your mask, as you descend and you start to feel your mask tighten on your face, all you're going to do is gently blow out of your nose to add more air into the mask. And this is going to equalize the pressure. This is also why you can't wear goggles when you scuba dive. You need to have your nose enclosed in the mask in order to equalize the air in there. Otherwise, you won't be able to do it and it'll be very painful on your face. Equalizing your lungs, and this is a very big airspace. The number one rule in scuba diving is to never ever hold your breath. The way you equalize your lungs is to simply breathe continuously and normally. As you descend, the air in your lungs will compress, and to counteract that, you have to just breathe. Breathing is going to add more air into the lungs, which is going to equalize the pressure. Now with the dry suit holds a layer of air around your body, and during a dive with the increasing pressure, this air is going to compress. Equalizing a dry suit does take additional training and certification. I'm not certified in a dry suit yet. I am going to become certified in the near future for a dry suit, so once I'm certified, I'm going to make an episode on everything dry suit and I'll include the equalization in there too. Other air spaces that can be affected but are very rare is a dental filling. Sometimes if the dentist doesn't do it the right way, there's a little pocket of air in between the filling and the tooth. And unfortunately, you're not going to know this is going to be happening until you start descending and you feel pain in your teeth. At this point, you have to end the dive because there's no way to equalize this. Go to your dentist, get it fixed, tell them, hey, I dive, I don't want this happening again. Make sure you do it right. and then hopefully he'll fix it. What are the consequences of not equalizing? There are ear and sinus injuries that can occur. You can have fluid accumulation in the middle ear, an eardrum can rupture, which causes severe vertigo, and then you'll need medical treatment for that. Mask injuries, you might get bruising around the eyes and the cheek area, and it's not gonna look good at all. It's not a very good look for any diver. And depending on how severe it is, you might have to see a doctor for it. And with your lungs, there's many consequences, all of them pretty severe if you don't breathe when you're diving. I'm gonna talk about 4 injuries, and the first one being the most dangerous, which is an arterial gas embolism, or AGE. And this happens by the expanding air, which forces bubbles into the bloodstream. And these bubbles have the potential to travel to your heart, to your brain, to other vital organs, which can cause stroke-like symptoms, unconsciousness, and death. The second injury is a collapsed lung. This is when air escapes in the space between the lungs and the chest wall, and the lung partially or completely collapses. This is going to cause severe chest pain and difficulty breathing. The third injury we're briefly going to talk about is mediastinal emphysema. I'm pretty sure I'm saying that correct, but correct me if I'm wrong. This is when air escapes into the center of the chest cavity. It can cause chest pain, shortness of breath, or a feeling of pressure. And the fourth injury we're going to go over is subcutaneous emphysema. This is when air escapes into the soft tissues under the skin, usually around the neck or chest area. This causes swelling and can cause a crackling feeling under the skin when touched. So again, number 1 rule in diving, never hold your breath. Breathe continuously and normal, long deep breaths. Do divers have to equalize as they ascend too? And the answer is no, you don't have to equalize when you're ascending. When you're ascending, the pressure decreases, and the air spaces in your body cavities, especially your lungs and your middle ear, will expand naturally. Your eustachian tubes usually vent out the excess pressure automatically, so there's no need to actively equalize. However, you must ascend slowly and breathe continuously. This will allow the expanding air to escape safely, especially from your lungs. Otherwise, you risk those lung overexpansion injuries that we just talked about. Now, here are some do's and don'ts for equalizing. Always equalize gently. Never force it because this can cause injury. Equalize frequently, every 2 to 3 feet. You want to equalize before you start to feel the discomfort. If you wait until you start feeling uncomfortable, equalizing might be really difficult or impossible. Never dive with a congested nose or if you have a cold. This will eliminate the ability to equalize your sinuses. And it's not recommended to take a decongestant either when you dive because these do wear off. And if they wear off during the dive, you can get something called a reverse block, also known as a reverse squeeze. This happens when expanding air in the diver's body cavity, typically in the ears, cannot escape during your ascent. So now it's kind of like the pressure on the inside of your airspace is greater than the pressure on the outside when you're ascending, and it can cause the pain and the discomfort and injuries as well. If you can't equalize your ears, stop your descent immediately. Signal to your buddy and let them know, ascend a few feet and try equalizing again. If you're unable to equalize for whatever reason, you have to end the dive. And again, because I can't say this enough, never ever hold your breath while you're diving. So if you follow those tips and you equalize the way you should, you'll be on your way to having a wonderful dive. Well, I hope that helped for your upcoming dives. If you enjoyed this content and want to see more, be sure to like and subscribe so you never miss an episode. And we'll see you later. Bye guys!